Feature topic today is going to be silver linings of COVID-19, and my lovely bride joined me today to talk about that. Janice, you actually engineered this whole topic. You want to tell how you did that?
Well, I had an engineer behind the engineer.
Mm-hmm.
My sister dropped about 15 articles in our lap, and she started looking up the benefits of COVID-19 and soon found that in the press it's called the silver linings. And
sounds like the old movie.
Yep, silver linings playbook, but it's COVID-19.
And yep, your sister's smarter than both of us put together, don't you think?
Yes.
So get us started. What's this about?
Well, it covers many different areas that we'll talk about today. Some will be the medical, maybe not advantages, but the growth and changes that we'll make in the future. From a big picture, I don't know if we have a slide on it, but there's decreased seismic noise in the earth, which is typically only seen around Christmas when people stay inside. And I guess once they get where they're going, they're off the road and they're home. And so
what, fewer trains, fewer cars, fewer big trucks?
Yeah, just noise, people staying at home. So we're seeing that, and they're able to monitor other very small events that usually don't even show up, like small earthquakes, small, volcanoes that are normally not even picked up. It has to be pretty big to overcome the noise that we're making on this earth.
Very interesting.
So
both of these images are dramatic.
Yeah, so this one is the drop in air pollution, especially in China and Europe. The greenhouse gas emissions have been falling. And then here in our country, in Los Angeles, they are having a stretch of good air quality, which has not been seen since 1995. So the photo on the left is July 1998, and then clear skies, March 2020.
Wow, amazing. So what's this about? Medical standards?
Correct. So protocols and evolving medical standards are taking place right now. And hopefully we'll see some of these into the future. I mean, in my list, which may not be on this and maybe it'll show up later on a slide, is that hopefully we'll have better testing, better quantity of PPE. Maybe we'll start using it on a more regular basis like it's used in Asia.
Speaking of testing, I've heard a couple of times that the U.S. has now surpassed other countries in terms of the actual number of tests done. Have you heard that?
I don't believe so.
I haven't been able to confirm it. Clearly not in terms of rate per thousand, but absolute number, which, obviously with 300 million, it's a large country.
Mm-hmm.
But remains to be confirmed. They talk about telemedicine here. Any comments about that?
Well, that is definitely evolving and something that I think will be retained in the future. As people are getting used to hosting their own Zoom meetings to see their relatives at home and have that connection, which is another silver lining.
Right.
The connectivity that we have with our families, with friends, they're getting used to using technology. And, I've seen people be very hesitant to join a Zoom meeting right now during COVID-19, but then you acquire a taste for it and you become quite capable. And so that will translate into medicine. And so, a lot of doctors are offering services through telemedicine because patients don't want to have a face-to-face with doctors, unless it's related to COVID-19 or to some very acute emergency. And as we mentioned a couple days ago, even China reported retroactive data where patients were coming in far too late because of the fear of face-to-face.
Denying their heart attack.
Yeah, they didn't want to get COVID-19. So with all that, we're beginning to see the use of telemedicine for non-emergency care, even specialists. I reported that earlier, maybe last week, that I had met with a specialist who I had never met with. So as a new patient myself. And so I think it's going to be really good for access to care. We've talked about disparities, among access to care. We've seen the statistics where the poor definitely is showing up with more COVID-19.
Right.
And the lifestyle, the poverty is a big problem. Also, we live in Kentucky. We have a lot of people living out in the country that don't have access to doctors unless, University of Kentucky is a draw area from people all over Eastern Kentucky. Now, hopefully, telemedicine, which was somewhat being offered, will now become a cornerstone of our medical future.
Obviously, I've got a whole bunch of personal agenda items. You had a personal experience with a doctor that agreed to use telemedicine.
He was offering, he was offering a specialist.
Obviously, given my background and my history and what I do, I have a whole raft of stuff about telemedicine. One of the things I've shown is the U.S. map for number of COVID cases, number of heart attack cases, and stroke deaths. And there's some places where stroke and heart attack deaths don't entirely correlate. And a lot of that appears to be due to what we call telestroke care. Now, telestroke care is very simple. It's major life-saving. It's been proven multiple times. And it's when the EMS, emergency medical systems, and the emergency departments in the area can coordinate well enough to say, okay, you can call in with the EMS to one of our docs, and we will go ahead and authorize clot-busting medicines on the way in. And that's for rural areas. And it greatly decreases mortality associated with stroke. It's not all over the country. And again, that's just one of these things where as a society, we are still struggling. Still been struggling to adapt what technology is offering us. Mm-hmm. And it costs lives.
Yes.
And I've done a couple of my own videos where, Doc, I would love to see you, but I live in Connecticut. And meanwhile, my cardiologist wants to use high-dose Lipitor and doesn't know that I've got insulin resistance.
Right.
And it's like, okay, I mean, you make your choice that you're not used to seeing a doc on telemedicine means, and that can very well cost you your life. It costs a lot of people their lives. And you're right, it's not just baby boomers, it's lower socioeconomic groups as well.
Right.
Just not getting out there in terms of telemedicine yet. But this is pushing it in that direction, and we'll end up saving a lot of lives.
And I do want to qualify, when people hear telemedicine, it really can be as simple as a phone call. But then it can also be a Google meeting, a Zoom meeting. Not everybody wants to do a video meeting. Obviously, if you're trying to look at something, say a dermatology type presentation, right. But we practice all kinds of telemedicine. And then the other thing not to overlook is that you have over 35 medical licenses or licenses in different states. So we're able to cover most of this country in our practice. So that's and even internationally. And
that's starting to sound like an advertisement. The bottom line is licenses don't really matter right now. Yeah. They've made changes with most states are saying on emergency basis, pandemic basis, doctors can take cases outside of their state. Yeah. And that's a good thing. And I expect that's been a major rate limiting step in terms of telemedicine in the past.
It's been a deterrent.
I'll be surprised if it doesn't continue to pave the way for getting over that state licensure issue.
Right.
Again, a lot of lives being lost because of failure to use that.
I want to point out the picture on this slide. Our health professionals are superheroes, the ones on the front lines dealing with COVID-19. The other changes currently affecting medical care right now are elective and non-urgent surgeries have been postponed to open up those beds. And then physicians across specialties have joined in to help. And I think you mentioned the other day, anesthesiologists who intubate may be called in to help with the COVID-19 patients. So there's a lot of dedication of our healthcare workers right now.
Okay, to me, you and Pam didn't have an article on this, but to me, this is one of our bigger items, pandemic preparedness. Michael Osterholm's book, The Deadliest Enemy, talks about things like we had N95 face masks that were only made in a couple of places in the world. For a while, it was only made in the Caribbean. One hurricane wiped out like all the plants, and it was a time when we needed it. Mm-hmm. And we still didn't get the point. Now we're starting to get the point. Making masks has become a cottage industry. You sent me some stuff, and James talked with me yesterday. He's got a lot of folks in the Amish community doing a lot of mask making.
There's a big group in central Ohio of Amish people making PPE for the Cleveland Clinic. And it's been all over the country.
And here's the thing. We never really saw those as safety or security critical industries before, that we always just approached it from an economic perspective. And economics had to do only with buying and selling and cost. They didn't think about the cost of lives associated if you don't have this. That's not going to happen again.
No,
for any of the PPE.
And it's been available in other countries. I had a friend tell me that they were in Singapore getting ready to go somewhere where a volcano was erupting. And they walked in a store and bought an N95. Now, where would we do that here? So again, it's a cultural difference that we don't have that available to non-healthcare workers.
Yeah. James is also, he's got some people going into, what's the name of that? Lowe's, into Lowe's to get these large, what do you call these? Bunches of Tyvek, big rolls of Tyvek, taking them over to cottage industries, which are using seamstress work in the past. And now they've gotten patterns for gowns, and they're making gowns out of Tyvek.
And we should mention 3D
house wrap.
3D printers are putting
for the face
shields.
Shields, yeah.
Which reminds me, the other day somebody mentioned plastic for face masks, and I think they were referring to face shields.
That's a good point. I bet you're right. Speaking of, people have mentioned a couple of things about COVID attacking the heart, or coronavirus attacking the heart. I got to take a quick digression on that. I've read up on that, and there is a lot of buzz going on about that right now. Again, I'm not going to be able to cover that during this event, but there's a lot of information. Bottom line at the end of the day is it may end up being a big deal. Right now, it's not, because, again, there's a final common pathway in terms of heart and lung damage.
Future YouTube Live.
Hopefully it will be. So improve awareness to surveillance techniques. We're going to be doing things a lot differently in terms of watching for things. For example, coronavirus has been around for decades. It is endemic now in the Middle East in the camel population. We're not going to change. Camels are like horses in the West and other places in the world. And you're just not going to get rid of camels. And they're not going to get rid of coronavirus. So we are starting to become very much aware, and I don't think we're going to take lightly the next potential coronavirus type of problem. There are a bunch of coronaviruses out there. This is one of 3 that has hit us so far, with SARS and MERS being the other 2.
Well, and just, we've been asked over and over, what is herd immunity? How many people would have that in their vocabulary a month ago?
Very good
outside
point.
of epidemiologists.
Very good point.
So people have more education about what this means.
And you hurt my feelings. I was fooling myself that I was able to do all the math in terms of R3 versus R2.
Let's not go back to that.
Okay. Antibiotic resistance bugs. You know, the multiple antibiotic resistance bugs, the flesh-eating bacteria and all these things. Those may actually be a bigger issue for us long-term than some of these viruses. And I think people are going to start taking it much more seriously. Big improvements in vaccine development, DNA, RNA, amino acid sequencing. That already happened this time. Within weeks, we had the sequencing. Production and testing are really the big issues. Production is starting to ramp up dramatically. And I think we'll have better human testing. I think that, again, we have some standards right now which are extremely conservative for human market testing, aftermarket testing, basically for good reason, to look for things like Guillain-Barré syndrome, other problems associated with the vaccine itself. Another quick digression, there has been a couple of cases of Guillain-Barré associated with the viral infection, not the vaccine. But back to this comment about vaccine human testing, I think as we continue to weigh the risks and deaths associated with wave 2 of coronavirus, HSV2, or coronavirus 2, versus the risks of going ahead and deploying something that we would normally consider not quite ready, I think we're going to make some adjustments in that area. And I think that's a good thing.
Well, that's similar to the plasma infusions.
Yeah.
You know, they're not completely...
Not quite ready for prime time, but they're
using
them.
Used.
Right, exactly right. So I think we're going to get better at saying, okay, we might not have met all of our conservative criteria in the past, but we've got a different benefit-risk ratio now. Speaking of vaccines, there's new developments in technology. There's a company called Moderna, and they have come out of the blocks. Big stock play for those who like to play stock markets. And they've never had a vaccine before, but they're coming out of the blocks. Big deal with coronavirus. One of the reasons is they have a totally different type of vaccine. So what they're using is the mRNA, messenger RNA, the genetic material. So instead of going in and having millions of eggs and you implant something and have the egg grow the protein and put the protein or antigen in the vaccine, inject it into the body, and depend on the human's immune system to find that antigen, that protein, react to it, all of that. This is a little bit different. What it is it goes ahead and sort of hijacks part of the human immune system and starts setting up. It bypasses the recognition. It bypasses these other components and does sort of like the virus in terms of coming in, setting up an RNA mechanism. You don't have to worry about recognition and all that. You just go ahead and start making the antibody. Very, very interesting new technology. Obviously has its risks, but a lot of opportunity. Fennell Hicks, I was talking with him earlier this week. You know, he's got that program with Cisco. Anyway, he's got a contract with one of these large chains with multiple factories. And basically what he does is he sets up facilities for health coaching, for working out, fitness, lifestyle within the plant. And he was making the point, he said, yeah, those are my clients. But one of the things that they're doing is they're looking at expanding this because now they know more and more jobs in the economy allow people to work at home. The economy is going to change dramatically. Obviously,
that will help with childcare.
It will help with childcare. It will help with a lot of things. Transportation costs, waste of hours a day in everybody's life, pollution, some of the things that we saw earlier. Obviously, it's tanking the economy right now, and don't want to underestimate the damage that's being done. But again, there's going to be some maybe leaner, meaner components to the economy in the future.
Did you read this article, Everybody Ready for the Big Migration to Online College? Actually, no. Now, that has been a big jumping off point.
It's been a big deal
for people in the middle of the year who were not prepared to teach college or even public education, elementary through high school, online. But they are doing such a good job, you know, the teachers and the professors.
Of remote teaching?
Yes, they are working so hard at that. And even, you know, showing not just teaching, but compassion for their students, engaging them. In Lexington, one elementary school had a parade of teachers go down the street through all their neighborhoods in their different individual cars with physical distancing amongst the teachers. Some teachers have shown up outside the door where a student is struggling with math and have stood there with a whiteboard with the glass door between them, demonstrating. I've talked to professors, you know, they're teaching, but they're also messaging and having contact with students individually to see how they are. Because again, some university students didn't even have computers, number one. I mean, again, we have to think about disparities. I read an article about Harvard where one student went to her second home in Maine to do her online classes. The other went back to Florida to work a taqueria, which was failing because they couldn't access meat. So I think the professors are very cognizant of the state of affairs in each individual student's life. So my kudos to our teachers and professors.
Yeah, a lot of the stuff that you're dealing with has to do with that first bullet point here. We have tended to assume digital and remote school, it's been a huge improvement in access, but it's been snake bit. It's been very difficult to get people to finish. I had the same problem. I didn't finish some of my genetics work at Stanford just because life got in the way. And if you've got a structure around getting up, going to school, it's a little bit different.
You can build that in, though, because our daughter's currently teaching in Santiago, Chile, her first time teaching university. And one of the tools she has used, because she can't check attendance because the connectivity is not always good, so not everybody can get into the live Zoom, she records it, but then she gives homework to assess attendance.
Right. And that's part of, I think, what part of the problems have been. You look at some things like school, and one of the major challenges has been the assumption that it just needs to be a broadcast, you know, like a show. And it's all pitching and no interaction, no catching, no
accountability,
and human interaction, no one-on-one interaction. Right. And then a lot of the examples you're bringing up are like the lady standing outside the door with the whiteboard. That's still one-on-one, but it's got components of remote.
And it has components of personal
personal commitment,
connectivity,
and
compassion.
accountability.
And
compassion and
because this student
accountability.
was crying about the inability to get her math homework.
Yep. Anything else on this?
No, I mean, the last bullet point, I think we've all seen, musicians are conducting performances and shows online free to the public right now. There's been Broadway shows, there's been symphonies, philharmonics, all kinds of things that have been opera at our disposal.
And I would say that's not new. That's the essence of YouTube.
Well, but it's new that it's available. Not everyone can go to the Met Opera, but now it's available.
Yeah, in the past, it was all the higher quality, the higher end stuff was not quite so readily available on YouTube because people wanted you to come to New York and pay mega bucks. And again, $150 for a ticket to go into the
And
show.
Children living in poverty have never been to the San Diego Zoo or some aquarium. And now there's really interesting broadcasts.
So more silver linings, traffic congestion. I mean, some of this is related to some of the things that we saw before. Less traffic congestion, empty streets.
I like the decreased accidents, and I'm sure we'll see the data on traffic accidents, traffic mortalities decrease.
But again, major impact on the community, major impact on health associated with this. But that's
the bullet point.
Not the silver lining.
People around the world are doing nice things for each other. And we've seen many examples of this in social media. I've mentioned a couple of them. And they'll understand the true value of face-to-face meeting. Another big thing people are doing right now is really, when you're confined inside all day, well, we're not confined by any means compared to other countries. And I like to qualify that because everybody is bereft that their life has changed so much. But some countries, you can't go out to take a walk. But when we do go out, I think there's a huge appreciation of nature in our environment and seeing things we never took the time to see. And I'm trying to teach you that value.
That's why I'm
smiling. Instead of talking about the next YouTube Live while we're walking, I'll be like, you can go out and walk with me if you will be an observer today.
That's why I'm laughing, because I'm still not understanding the true value of face-to-face meetings. And you and I have talked about it. I traveled for like almost 30 years for a living. And for over a decade, I was in my hometown maybe 3 days a month. It's just way too much travel. And so now that I've retired and I'm doing things remotely, I love it.
Well, it might not mean purely business meetings. It may mean seeing their relatives. I'm sure you would be glad to Zoom with me every day.
Well, we talked about making that trip over to see Jeffrey and Raven.
Yeah.
I was totally comfortable Zooming them, FaceTiming them.
And that's you.
Yeah,
but a lot of people do miss that face-to-face contact.
And I will at some point, I'm sure. Okay, anything else about life's simple pleasures, food, recipes? I made up a good recipe today.
Yes, you did. You want to describe it?
Cauliflower with a little bit of cheese, a little bit of avocado oil, a little bit of bacon flavoring in that avocado oil, a little bit of olive oil-based margarine taste to it.
It was like a baked potato, but it was cauliflower rice, correct?
Right.
But I think that even that, trying super healthy recipes and home-cooked meals, I've leaned on my sisters, my daughter, my son's girlfriend, people I do Tai Chi with to cook new recipes. But I like this one quote from Amy here. We saw our youngest kid's first steps. Think about how many parents miss that while they're away from work. That's a big deal.
Big deal.
That's another good one below that, Caitlin. People are enjoying the outdoors without looking at their phones.
Yeah. I tell you what, I do appreciate going outdoors more than I used to. And I will appreciate it if I can ever start going back to the Y. Why wait for a disease and hope for a cure? I used to be an ER doc. My name is Ford Brewer. I quit ER after a few years because it was just so frustrating. Most of the things bringing people into the ER are things that should have been prevented, including heart attack, stroke, #1 cause of death, #1 cause of permanent disability. People think that you're just going to have those and that they're not predictable. Both of those are wrong. They are predictable, and you don't have to have them. Usually it's lifestyle. Lifestyle is more important than supplements and even prescription drugs and even stents and surgery. But the current times are tough. Major financial impact with the lockdowns that most states have been going through. We've been working on a way to make this much more affordable with a subscription process. And that's exactly what we're announcing today. We've got 2 levels. One is the silver membership, where you get access to our courses, a private webinar each month, and access to our supplement store and supplement recommendations and prescription. Or I would suggest even more so, the gold membership. You can get a script for a Freestyle Libre and find out what your blood sugar metabolism's doing on a daily basis. And you can get a lab order for inflammation, OGTT, and insulin survey. You can also get a 30-minute one-on-one with me. So I'm looking forward to seeing you. Cost is no longer an excuse. So if you're interested, go to go.prevmedheartrisk.com/prevmed-subscription or call us at 859-721-1414, 859-721-1414, or email us at myhealth@prevmedheartrisk.com. Looking forward to seeing you. Thank you.